All right, all right. Welcome to Beyond the Surface. My name is Sam Salazar. I am the founder of AI Psalms. Today, I'm excited to speak with Steve Bonner, CEO of SkiniO, an AI-powered platform that lets users complete a full-body skin cancer screening in just 10 minutes from their smartphone or iPad, making early detection faster and more accessible than ever. How are you feeling today, Steve?
Wonderful, Sums. How are you today?
We're having a great morning. It's 8 a.m. where I'm calling from. What time is it where you're calling from?
It's 10 a.m., so I'm 6 hours into my workday, but I got a full head of
Okay.
steam. Yeah,
Wow, 6 hours. You must have woke up pretty early.
that's what I do.
That's good. Early bird gets the worm, is what they say. So. Okay, awesome. So, Steve, before we dive into SkiniO, can you tell us a little bit about your background and what first got you interested in technology and entrepreneurship?
Sure. I'll try to do the kind of quick version.
Oh, take your time. Take your time.
Okay. I'm a recovering lawyer by education, but I came out of any practice of law many years ago and actually got involved with entrepreneuring and built three multi-billion dollar businesses inside of three big financial services companies. And then in the mid 90s was introduced to the founder of a company called Cancer Treatment Centers of America and went through a deep discussion with him about his innovation in healthcare. And as I looked at it, it was a powerful and disruptive transformational kind of an innovation. And basically, our target market was people with complex late stage cancer. And we offered two major transformational offerings to them. Number one was a fully integrated style of care. And at the time, in the late 90s, the big cancer providers were offering great chemosurgery and radiation, but they were, in our opinion, ignoring the immune system. And the irony of those treatments is that they assault the immune system intentionally to try to suppress the growth of cancer. So you've got a suppressed immune system at exactly the time when you need the most powerful immune system you can possibly have. And our view was that if you integrated those treatments, those traditional treatments with complementary therapies, nutrition, naturopathic intervention, exercise, fitness, the architecture of care, humor therapy, laughter therapy, pet therapy, anything that would support the immune system, you would get a much better experience for the patient and a much better outcome. And we also were then a direct to consumer offering in hospital-based cancer care, which was not done anywhere. And so I was intrigued and jumped into the CEO role in 1999 and agreed to stay 15 years. And we went from 300 people to 5,000 people, from one hospital to five hospitals across the country, and from 100 million to over 3 billion of revenues. And really did transform the business. The major competitors all looked at what we were doing with complementary therapy and they said, that's voodoo medicine, that's false promise, there's no science behind it. So we created the science and we published over 200 peer-reviewed abstracts on how these things all work together. And now you can't go to a quality cancer provider, but what they're not offering you nutritional support and naturopathic support, psychological support, and so forth. So that was that 15 years. I stayed the 15 years and then migrated out of there, stayed on the board for a while. And I've now built a portfolio, Salms, of 25 healthcare companies where I'm an investor, advisor, board member, and all of them have at their core an idea and a team that has, in my judgment, a potential to drive that kind of transformation through healthcare. And we all know how important healthcare is and how difficult it is to access it and get quality cost access and outcomes in American healthcare. So that's where I'm spending my time. And in the 2017 range, I got deeply involved in a startup in dermatology and wound up staying with that, built it through from 4 clinics to 164 clinics. And along the way, met the team at SkiniO and became enamored of what I think is another truly transformational offering for skin cancer patients. And as a result, left the dermatology chain and jumped into the CEO role of SkiniO in September of 2023. So I'm just 2 years into it.
Awesome. That's quite an impressive track record. I was curious, when you first joined SkiniO, I mean, it may be considered common sense of your biggest concern was detecting skin cancer, but what was something that you were most passionate about that maybe has evolved over time? I know you just joined, but you've been in the business, the health business for a while. I'm just curious to how your initial objective when you join has evolved to now.
Okay, great. Well, the quick backdrop on the current market, before you put SkiniO into the market, we know now statistically, roughly 33 million Americans are walking around with undiagnosed skin cancer. 5 to 10% of the US population, and our statistics prove this. It's a reality.
Hmm.
There are 10,000 practicing dermatologists in the US, and they're serving the whole dermatology market, not just skin cancer. And so the path from concern about a spot or something that you're seeing in your skin to true detection and care is enormously protracted for the potential patient. And if you call a dermatology office anywhere in the US and say, I need to come in to get my skin looked at, it's 3, 6, 9, 12 months. And some practices aren't even accepting new appointments. And so you're left in this dermatology desert with something that could be truly life-threatening. And what excited me about the technology, and it's not just technology, it's technology and process that deliver the breakthrough, is that we can do all of the initial analysis before you have to see the dermatologist.
Mm.
And what our technology does, you mentioned it, is it gives us the ability to offer the worried patient download an app onto their Android or their cell phone, iPhone, or better yet, onto an iPad that guides them through a full body skin analysis. So it captures images of 13 different regions of the body. And the technology looks like facial recognition software. So you start with head and neck, an outline of head and neck comes up. There's AI in the app. So the AI in the app starts guiding the quality capture of the image process. And so closer, farther, better angle, better lighting, better background. And as soon as it gets a quality image, the outline turns from white to green, and it uploads the image into our cloud database. The AI is also looking for suspicious spots, and if it sees something, it'll guide you to take a discrete photograph of that so that we can also have that in our database. So it takes 10 minutes to conduct that personal skin exam. And then up in the cloud, we have another AI application that begins by making a mathematical computation of the normal skin of each patient. So we know mathematically what the profile of your skin is. And then we use the AI to look for statistically significant outliers from your normal. And so a freckle, a hair, a tattoo, a piece of jewelry, those are outliers, but they're not statistically significant in our model.
Okay.
What's statistically significant are things that have characteristics that look like they might be evidencing skin cancer. And so the technology highlights all of those, and then the full set of scans with the highlights go to one of our panel of dermatologists that review this data. And the dermatologist does a complete review of all of your scans. And then within 48 hours of the 10 minutes when you conduct the exam, you get a report back that tells you one of three things is observed. Number one is there's nothing here that looks like a problem at the moment. We now have baseline scans for you, and we can guide your skin care for life. Every time you do another scan, it'll not only look for statistically significant outliers, but it'll look for changes in your skin. And so this is available to you. It's part of the basic service that we offer. Number two, and that's about 2/3 of the people we scan, some are in that no immediate apparent problem. So one thing we've done is we've taken 2/3 of the worried well out of that pipeline in the dermatology clinic and freed that up for people who really need it. Very friendly contribution to the dermatology universe.
Yeah.
And about 20% of the people, we say there's something here that will benefit from being seen. When you next see a doctor or dermatologist, take our scan with you and have them make sure they look at it. And then 5 to 10%, there's something here that needs to be seen in clinic as quickly as we can possibly arrange it. And then that's the technology and our dermatology review. What we've built is a network of so far 600 practicing dermatologists around the country whose core commitment to be part of our network is that they will see any one of our scanned patients in clinic within 2 to 3 weeks.
Oh, wow.
So from seeing a spot to being in clinic for true intervention, 1 month. And we charge about $200 for our full range of services right now. So the app, the scan, the statistical or the technological analysis, the dermatology review, and the introduction to a dermatologist, all for $200. Whereas the first 15-minute eye skin exam, the visual observation in clinic by a dermatologist, is $250 to $350, depending upon where you are in the country.
Okay.
Accuracy, Stanford Dermatology did a study with us and published a paper and said that they think that one of their well-experienced in-clinic practicing dermatologists doing a visual observation of someone's skin might approach 80% accuracy. They said our technology performed at 95% accuracy. So 1 month versus a year, 95 versus 80% accuracy, $200 versus $250 to $350. Quality, cost, access, outcomes, all really tremendously breakthrough offering. Yeah. And the whole dermatology ecosystem, the skin cancer ecosystem, wins with this. There are no losers anywhere along the spectrum. So that's what I saw when I came, was the potential in the technology. We have 2 patents on the technology. Our founder is a very sophisticated practicing dermatologist. He's still passionately connected. He's our chief medical officer. So we had the talent, we had the technology, we had IP protection on the technology, but we're really creating a new market. You move to the challenges. Probably the first one is education.
Yeah.
And we're right now selling primarily to large employers and to unions, but we're also trying to bring the insurance companies and the government along with this whole new model of care. And we're also just launching our direct-to-consumer offering as well. And so this is very different as a healthcare benefit offering than anybody's used to seeing.
Yeah.
It's simple, it's easy, and it is standalone. It doesn't have to integrate, with your annual benefits process. We can put it in any time.
Yeah.
We go to employer sites and we'll conduct scanning there at health fairs, or for United Airlines, we go to their regional hubs where crews are changing flights, and we'll capture them and do a scan for them as they change flights. Very convenient, very accurate. But it's not just finding the problem, which is what a lot of scanning technology does. It connects you to the solution. And nobody's used to seeing that. So we have to get out and we have to prove what it is, how it works, how you buy it, and also does it work. And we've got a very sophisticated actuarial model that helps us predict for an employer the economic consequences of buying SkiniO technology and implementing it with their workforce. And basically, in year one, they're going to spend a little bit more than they're going to get in terms of a return. But in year two, it turns positive. And by year five, an employer with sort of average incidence of skin cancer should make 5 times what they spend on our scans in healthcare savings. And the savings engine comes from early detection and diagnosis and treatment of skin cancer. We had a wonderful United Airlines pilot come to our scanning event in San Francisco Airport this year and walked up and he said, "Hi, I'm Scott. I'm back and you saved my life."
Oh, wow.
And we said, "How did we do that?" And he said, "Well, last year I came for a scan because I saw something on my arm that I was worried about. You scanned my whole body, and the spot on my arm was nothing, but you found a melanoma on my back the size of a fist that I had no idea I had." And so we got him in, we got him treated and cured. If he'd waited 2 years or 3 years with a melanoma, I mean, it can be life-threatening, but you can go from a $5,000 curative clinical intervention at stage 0 or stage 1 to $500,000 in 2 years. And so we capture the savings based on type of skin cancer, stage of skin cancer, healthcare savings, also time off work is reduced dramatically. Also for the employee, the out-of-pocket co-pays and deductibles are much less because it's lower. And then, realistically, we're saving lives.
Yeah.
So the combination is very powerful, but the market's not used to seeing it. It comes back with too good to be true. Everybody is very busy and everybody's got an innovation. So fighting for share of mind and getting it in front of the right people is a big challenge for us. And just establishing enough of a footprint and credibility by performance. And we now have about 1 million lives under our umbrella. We've scanned 50,000 people so far. We're generating some nice beginning revenues, so our economic profile is getting better. But that's kind of that's the high level overview and the front end challenge that we face, and we can go deeper on reimbursement as a challenge, whatever you think would be of interest to the audience.
There was a few things that came to mind that I was curious about. One was when you mentioned the selling to unions, employers on that front, are you targeting certain industries that are, this may be a common sense question, but are you targeting certain industries that are prone to skin cancers, people that maybe are higher risk, or how does that work?
Yes, we're targeting known higher risk industries, and higher risk is generally sun exposure. That's the number one risk factor with skin cancer. But in our database, the other key indicators, risk factors are age, gender, ethnicity, history of skin cancer, or family history of skin cancer. And so we look at that. We also know from a economic point of view, self-insured employers have higher in-pocket risk than those who are fully insured. So we're looking for that segment as well. But to answer your question, the airline industry is clearly a higher risk industry, higher incidence of skin cancer. And United Airlines has proven that. And because of that, we're now scanned about 5,000 of their 100,000 employees. And we're projecting a 26 times return on their investment in our scans within 5 years because of the higher incidence. So we're in deep conversations with other airlines. We've got a face-to-face meeting with one in Florida next week to hopefully make a final sale. We've got initial approval for a pilot, pun intended, at American Airlines. So That's one. Um, any place that has outdoor workers, US Foods is another big customer of ours. They have a lot of employees who are, on loading docks and trucks, moving product around. So looking at those types of industries are important. Athletes
Mm,
who live outside. So we're into conversations with a Major League Baseball team
mm,
where the owner has said, I want this in my culture. Now go and get it done. We're in conversations with Justin Thomas, who's one of the top handful of professional golfers, who's a melanoma survivor. He
mm,
started his own line of skin protection products. We're talking to him about helping us get in front of the golfing audience.
mm.
Obviously, professional soccer will be another very important one for us. And there's not just professional, but there are the college athletes as well. And selling into colleges and universities is another important vertical for us. So the answer is yes. And those are some of the early indicators of the industries that we're trying to target.
Yeah, that's very helpful, I think, for the audience, for people to know, because my apologies, T-Mobile was calling me. Uh, I think I think lost my train of thought. I think when you mentioned the education, and I mentioned earlier in our podcast call that a lot of people, especially people of color, aren't aware that they could be someone prone to skin cancers. And I think that's really important because even myself, being Black and Native American, Hispanic, that is not anything I've even thought about just because I was informed that if you're a person of color, you're melanated, you don't have a sensitivity to the sun, we don't sunburn, on the surface, we seem protected, right? But you are here today to debunk that. So can you go into that a little bit just for the audience?
Yes. And there are nuances as to where and when skin cancer occurs based upon some of the ethnicity variables that you've talked about. But no ethnic group is free of skin cancer.
Okay.
And I also don't believe that darker skin is free of sunburn and sun damage. I mean, sun damage is the
Yeah.
key. And
Yeah.
so it occurs. Interestingly, skin cancer is occurring at younger and younger ages the last few years. There's an American Cancer Society publication out that indicated that it is showing up at younger ages. It's showing up across the spectrum of skin colors. It's slightly more prevalent in women than it is in men. Interestingly, skin cancer appears much more frequently in the bottom of the feet of the Black population than in other places and than other ethnicities and between the toes. And this is a very important learning for us. And we have 13 regions we're scanning now. We're getting ready to put in another one specifically focusing on the bottom of the feet. So none of us should feel insulated from the risk of skin cancer. And again, having the ability to easily track your skin for life. And right now, our technology is focused on skin cancer, but we have the ability to teach it to look for other things and to be able to help find things and get people the care that they need, connect them to care,
Hmm.
has significant growth potential in it. And
Yeah.
so uh, the one example is we were contacted by the Johnson and Johnson Skin Innovation Lab folks last summer, and they said they had looked at all the skin scanning technology in the world and concluded that ours is by far the best, the most accurate, the most easy to use. And they're talking to us about adapting our technology to support their skin trials. They do skin product development, drug development, and so forth. And they run clinical trials to be able to prove the value of those. And
Hmm.
the challenge with clinical trials is, number one, to find qualified patients and get them enrolled in the trial. And second is to keep them compliant with the trial.
Yeah.
And what they're saying is right now, everybody in our clinical trials needs to come to some place to get their progress observed and assessed. And if we could use our technology to let them scan it at home and get it to the clinic that way, their clinical trial effectiveness and efficiency would be increased as well.
Mm.
So it's, as I say, it's transformational.
Yeah.
It's kind of ironic to me. We are coming through the persuasion of the insurance companies, but the irony to me is that the whole system will gladly pay for us to get our teeth checked twice a year, pay the full cost of it, and no questions asked.
Hmm.
I don't know of many people who die of cavities.
No, but it is possible.
Oh yeah, I know it's possible, but statistically,
Yeah.
more people die of skin cancer by far than die of cavities. And so it's
Yeah.
back to our need to educate the system
Yeah.
on where smart money can be sent and where it's going to come back to everybody in terms of much lower cost and much higher quality and length of life.
Yeah, absolutely. I 100% agree. Let's switch gears for a moment. You mentioned earlier about the challenges, and you sort of brushed on this for a second, but I wanted you to go a little deeper if you didn't mind. As SkiniO continues to grow, what are the primary challenges in scaling your platform, and how do you plan to overcome them?
So the good news is the technology is eminently scalable.
Okay.
Um, we're not we're not capital intensive. We don't require huge investments in capital to make it scalable. We live in the cloud. The cloud is very expandable, extendable. We're extremely secure, HIPAA compliant. All the data comes out of the devices and goes into our cloud, so nothing is stored on a device that could be hacked by anybody. Our patients have control of access to their data in the cloud, and they can see it. And if anybody else they want to authorize to see it, they can see it.
Hmm.
But all those aspects are very scalable. The product quality itself and the customer interface, especially in direct to consumer, needs more refinement to make it as easy as possible. And now we've got the iPhone 17 coming out. It's got far better camera technology in it. We want to adapt and be prepared to make the most of that. Excuse me.
Hmm.
Um, the the real scalability challenge we face is in the go-to-market side of it, and having great people and great processes in place, excuse me, to help us be available, to
Hmm.
be understandable,
Hmm.
to be trustworthy,
Hmm.
and reliable. And we've got right now we're 22 people, Psalms in the team.
Hmm.
We're going to do 2 million of revenue this year. We want to do 7 million next year. And I just was on a call with the team before this call talking about looking over the horizon and asking ourselves, what do we need to get from here to 2.5 times where we are next year?
Hmm.
And so we know that we know what great feet on the street look like. We know what great support looks like. Also, I mentioned we run these events, on-site events for our customers, and they're so energized and so powerful. And I've attended a couple of them. I did one with United Airlines in the O'Hare Airport this year, spent 10 hours, involved with hosting people coming through for their scans.
Hmm.
And we used to contract out the scanning responsibility. We'd bring in contractors, no more. Everybody conducting these events now are our employees. They understand the technology, they understand the culture of who we are and what we're presenting,
Hmm.
and the quality of the scans and the quality of the experience and the efficiency of the experience has gone up.
Yes.
So how many of these teams do we need? I kind of have this vision of our teams being distributed around the country. They've got a Sprinter van with our logo on the side, and they've got our privacy tents in them. When we go to an event, we set up privacy tents so we can do these skin scans. It's got all of our scanning technology. It's got fans. It's got the great Wi-Fi connection. And we've got these within an hour of every employer in the country, and they can easily move from place to place. Scaling that will be a real challenge. And
Yeah.
our plan for 2029 is that we'll conduct 400,000 scans that year. We'll do about 20,000 this year.
Oh,
And
wow.
so the technology can scale, but again, what is it going to take to really be out there creating a wow customer experience? And that's kind of scale. And again, when we're doing 400,000 scans on a population of 300 million people, we're still just barely into the market. What is it going to look like when we get scanning 30 million people a year, let alone 300 million, which is roughly where we should go?
Yeah, absolutely. Well, before or as we wrap up, I would love to ask you one more question. Looking back, actually, I have a different one. If we take a step aside from the AI, the technology, and all of that, if you look back on your career, how would you say you operate in your best flow in during this evolution of skin cancers and technology? I'm just curious to how you keep a good, healthy mind and a state and flow to optimize and work at your best.
It's a great question. And the first assumption is that I do that, but I think it's a journey for all of us. We probably never get there. And I mean, there are several things. And number one for me is I love what I'm doing.
Hmm.
And I think that we all owe it to ourselves to find something that gets us out of bed in the morning, excited to go where we're going. And so I've checked that box for myself on this. I just think it's very exciting to be able to
Yeah.
do it.
Yeah.
Um, I also am very focused on creating a culture of innovation, creativity, hard work, and success, and being the best place to work for everybody.
Yeah.
And just giving them that passion isn't enough. And so, um, balance in your life, and I'm way over balanced to work. I tend to work too much, but I have 4 private Pilates sessions a week in studio, and when I'm traveling, my coach comes on Zoom with me, and we do it on Zoom in a hotel room. But that is something like that, I think, is critical for all of us. And I just wish I had done it for myself earlier. I've been doing that for about 8 years, but especially as you get up in age, the body at rest is not a healthy body. You've got to
Mm.
find time to make it move. I'm also very focused on the whole spectrum of happiness.
Mm.
And one part of happiness is this pillar of loving what you're doing and doing what you love. But then there are other things, and there's a really compelling expert on the science of happiness, Arthur Brooks. And I don't know if anybody's run across him, but he's a longtime friend who transformed himself, left another job apart, and has now devoted his life to the science of happiness. And he teaches the science of happiness at Harvard Business School
Okay.
and at the Divinity School. He's got podcasts, and he'll tell you there are 4 pillars of happiness at the core of us as human beings. And guess what? One of them is not Facebook, and it's not X, it's not social media. In fact, that tends to deteriorate happiness. We need to manage that part of our life, but
Yeah.
we get sucked into that and it takes up too much time. But
Yeah.
it's something you love to do, something that's meaningful, that in your heart knows can make a difference.
Hmm.
Family is critically important, and consciously investing in family is a very nuanced kind of an issue. You know, we don't get to pick our families, and they sure aren't perfect. But, you know, taking the time to let them know that we care and to debate and discuss and disagree and all that is a very healthy part of our lives. And so trying to craft that into the environment is very important.
Yeah.
And then finding things that give us joy
Yeah.
are important parts of kind of where I find my growing happiness. But I still have this instinct. If I have to choose between Pilates and another hour of work, if I'm not careful, I'll do the hour of work because I love what I'm doing. But that's where having this commitment with a coach for 8 years to be there for each other
Yeah.
helps to discipline some of those unhealthy instincts.